The mental health of young people is a topic of increasing global concern. Gen Z in particular faces unprecedented challenges. These include the rise of social media, climate change, and economic uncertainty. These pressures have led to a surge in anxiety, depression, and other mental health issues among young people. This generation is growing up in a world that feels increasingly uncertain and complex. The statistics paint a stark picture. According to the World Health Organization, 1 in 7 adolescents globally experiences mental health challenges. These challenges can manifest in various ways, from persistent sadness and hopelessness to more severe conditions like bipolar disorder and schizophrenia. The impact of these challenges can be devastating, affecting not only the individual's well-being, but also their education, relationships, and future prospects. It is crucial to understand that mental health is not simply the absence of mental illness. It is a state of well-being in which individuals can cope with the normal stresses of life, work productively, and contribute to their community. Mental health is a fundamental human right and essential for overall health and happiness. The good news is that there is growing awareness of mental health issues, particularly among young people. This awareness has led to greater openness about mental health challenges, reducing stigma, and encouraging help-seeking behavior. However, significant barriers to accessing quality mental health care remain, particularly for marginalized communities. Despite the growing awareness, recent data reveals a mixed bag of progress and setbacks in youth mental health. On the one hand, the Centers for Disease Control and Prevention reports a slight decrease in persistent feelings of sadness and hopelessness among adolescents in the United States. This decline is particularly noticeable among female and Hispanic students. Additionally, suicide attempts among Black students have also decreased. On the other hand, there are worrying increases in other areas. School violence, including threats and injuries with weapons, has risen. Bullying rates have also surged, with a significant proportion of LGBTQ+ students reporting being bullied. These trends highlight the urgent need for effective violence prevention programs and support systems within schools and communities. The CDC also reports an increase in the number of students missing school due to safety concerns. This statistic underscores the profound impact that violence, bullying, and fear can have on a young person's life. It emphasizes the need for comprehensive approaches that address both mental health and school safety. It is important to note that these trends may not capture the full extent of the problem. Many young people still hesitate to seek help or disclose their struggles due to stigma, fear of judgment, or lack of access to resources. The true prevalence of mental health issues among adolescents could be much higher than reported. Access to quality mental health care remains a significant challenge for many adolescents. The Substance Abuse and Mental Health Services Administration estimates that only about 1/3 of adolescents with a major depressive episode receive treatment. Even fewer receive the recommended combination of therapy and medication. Several factors contribute to this treatment gap. One significant barrier is the stigma surrounding mental illness. Many young people and their families may hesitate to seek help due to fear of judgment, discrimination, or shame. This stigma can prevent individuals from acknowledging their struggles, seeking help, and receiving the support they need. Another obstacle is the lack of accessible and affordable mental health services. Mental health professionals, particularly child and adolescent specialists, are often in short supply, especially in rural and underserved areas. Long waiting lists, high costs, and limited insurance coverage can make it challenging for families to access timely and appropriate care. Furthermore, the current mental health system often fails to adequately address the unique needs of adolescents. Young people require developmentally appropriate care that considers their evolving emotional, social, and cognitive abilities. Services should be tailored to their specific needs and preferences, providing a safe and supportive environment for them to heal and grow. Despite the challenges, Gen Z is not passively accepting the mental health crisis. They are actively seeking solutions and driving positive change, both for themselves and future generations. This proactive approach is evident in the emerging trends shaping the landscape of youth mental health. One prominent trend is the increasing focus on mental well-being in branding and marketing. Gen Z is drawn to brands that are transparent about mental health, promote inclusivity, and advocate for positive social change. This shift reflects a growing desire for authenticity and a rejection of traditional marketing tactics that perpetuate unrealistic beauty standards or promote unhealthy lifestyles. Another significant trend is the rise of sleep optimization. Gen Z recognizes the importance of sleep for both physical and mental health. They are increasingly embracing techniques and technologies to improve their sleep quality, such as establishing regular sleep schedules, creating relaxing bedtime routines, and utilizing sleep tracking apps. Gen Z is also prioritizing financial stability as a crucial aspect of their overall well-being. They are acutely aware of the economic challenges facing their generation, including student loan debt, rising housing costs, and a competitive job market. As a result, they are embracing financial literacy, budgeting, and investing as pathways to greater financial security and reduced stress. Furthermore, Gen Z is leveraging the power of technology to connect with others and combat loneliness. Online communities, social media platforms, and virtual support groups can provide a sense of belonging and shared experience. However, it's crucial to balance online interactions with real-world connections and engage with technology mindfully to avoid the potential pitfalls of social media, such as cyberbullying and social comparison. In conclusion, while the state of youth mental health presents significant challenges, Gen Z's proactive approach offers a glimmer of hope. Their willingness to openly discuss mental health, prioritize self-care, and advocate for systemic change is paving the way for a brighter future. It is imperative that policymakers, educators, and communities support these efforts by providing accessible, affordable, and culturally sensitive mental health services that meet the unique needs of this generation. By working together, we can empower young people to navigate the challenges of the modern world and build a future where mental well-being is valued and supported for all.